High blood pressure medicine can be a true lifesaver, and many of you are on it every day. If you take Losartan, or any blood pressure pill, this talk is for you. I'm not here to scare you or tell you to stop your medicine. I'm here to explain, in plain English, what side effects to watch for, why they happen, and when it's wise to call your doctor. Think of this as a helpful guide you can trust. We'll go step by step, so you feel confident, not confused. You'll learn which symptoms are common and usually settle down, which ones need a simple lab test, and which rare signs should never be ignored. I'll also share small, practical habits that make these medicines work better with fewer problems, like how to stand up safely, when to check your pressure, and which questions to ask at your next visit. Your health is your power, and you deserve clear answers. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Point 1. Dizziness and lightheadedness. Let's start with one of the most common side effects many older adults notice when taking Losartan or other blood pressure medicines, that sudden dizzy feeling when you stand up too quickly. You might feel as if the room is spinning or that your balance isn't quite steady for a moment. This happens because Losartan relaxes your blood vessels, which is exactly how it lowers your blood pressure. But when those vessels are too relaxed, especially after sitting or lying down for a while, blood rushes to your legs before your heart can push it back up to your brain. That little delay causes lightheadedness. It's nothing to panic about, but it's important to manage it wisely. The best way is to move slowly, sit up first, take a breath, and then stand. Drinking enough water and avoiding dehydration also helps your circulation stay strong. If you're taking more than one blood pressure medicine, ask your doctor whether the timing of your pills might be adjusted to reduce this effect. Most people find that the dizziness fades as their body gets used to the medication within a few weeks. But if you start feeling faint, or if the dizziness keeps getting worse, don't ignore it, call your doctor right away. Point 2. Headaches and pressure sensations. Many people notice headaches during the first few weeks of starting Losartan or another blood pressure medication. It can feel like a dull pressure behind the eyes or a heaviness around the temples. This often worries people, but here's the truth, in most cases, it's your body adjusting to a new level of blood pressure. When your blood vessels begin to relax and open up, the sudden change in pressure can cause a temporary headache. It's similar to when weather changes make you feel pressure in your head, uncomfortable, but not dangerous. Most of these headaches fade once your body gets used to the medicine, usually within a few days to a few weeks. If your headache feels stronger than usual, lasts too long, or comes with other symptoms like blurred vision, weakness, or confusion, that's the time to call your doctor. Sometimes it's not the medicine itself, but another reason such as dehydration, skipped meals, or even stress. Drinking enough water, resting well, and staying consistent with your medication schedule can help reduce these headaches. Remember, every person reacts differently, so pay attention to your body and note what feels off. Adjusting doesn't mean something is wrong, it means your body is learning to find its new balance. Point 3. Fatigue and low energy. It's quite common for people on Losartan or other blood pressure medicines to feel more tired than usual, especially at the beginning. You might notice your body feels slower, or you just don't have that same spark of energy to move around or do your usual chores. This happens because your medicine is lowering your blood pressure, which means your heart doesn't have to work as hard as before. While that's good for your long-term health, it can make you feel drained for a little while as your body adjusts to its new rhythm. Sometimes this tiredness also comes from how Losartan affects certain minerals in your body, like potassium and sodium, or from small changes in your sleep patterns. It doesn't always mean something is wrong, it's simply your body finding a new balance. You can help yourself by staying hydrated, eating light balanced meals, and taking short walks to keep your circulation strong. Gentle movement actually boosts your energy over time. If the fatigue continues or starts to interfere with your daily life, for example, if you feel sleepy all day or too weak to do things you enjoy, speak with your doctor. A small change in the timing or dose of your medicine often makes a big difference. Point 4. High potassium levels. Now let's talk about something that doesn't always show clear signs: high potassium levels, or what doctors call hyperkalemia. Losartan can cause your potassium to rise slightly because it changes how your kidneys handle certain minerals. Potassium is important; it helps your muscles, including your heart, work properly. But when it builds up too much, it can affect your heartbeat or make you feel weak and tired. The tricky part is that most people don't feel any symptoms until their potassium gets quite high, which is why regular blood tests are so important. Your doctor usually checks your potassium a few weeks after you start or change your dose. If you have kidney problems, diabetes, or take other medicines that raise potassium, you might need more frequent tests. You can help by avoiding overuse of salt substitutes made with potassium, and being careful with foods that are very rich in it, like bananas, oranges, and tomato juice. You don't have to give them up completely, just enjoy them in moderation. If your blood test shows that your potassium is climbing too high, your doctor might adjust your medicine or help you balance your diet. Staying informed and checking your lab results regularly is the best way to keep your heart safe. Point 5. Kidney function and monitoring. Losartan is well known for protecting the kidneys, especially for people who have both high blood pressure and diabetes. But it can also cause small changes in how your kidneys work, which is why regular blood tests are so important. When you first start taking Losartan, your doctor might notice a slight increase in your creatinine level. That's a number that tells how well your kidneys are filtering waste. For most people, this small rise is temporary and actually means the medicine is helping the kidneys adjust to a healthier pressure. However, if you already have kidney disease or take other medications that affect your kidneys, like pain relievers such as ibuprofen, your doctor will keep a closer eye on your test results. Point 6. Low blood pressure, feeling faint or weak. Sometimes Losartan can lower your blood pressure a little too much, especially when you first start taking it or if your dose has been increased. You might notice that you feel faint, weak, or even a bit foggy at certain times of the day. This happens because your blood vessels are more relaxed, and your heart doesn't have to push as hard to move blood through your body. For most people, that's exactly what we want, but for some, the pressure can drop a little too far. The best way to handle this is to be gentle with your body. Don't rush when standing up, especially first thing in the morning. Sit at the edge of your bed for a moment, take a deep breath, and then slowly rise. If you're taking other blood pressure medicines or water pills, diuretics, ask your doctor whether your timing or doses need adjusting. Staying hydrated also helps your blood flow evenly and prevents sudden drops. If you ever faint, feel your heart racing, or find it hard to think clearly, that's a sign to call your doctor right away. Most people notice that this lightheaded feeling fades after the first few weeks once their body adapts, but paying attention early helps you stay steady and safe. Point 7. Cough or nasal congestion. Although Losartan is much gentler on the lungs than older blood pressure medicines, a few people still notice a dry cough, stuffy nose, or mild throat irritation after they begin taking it. This can be confusing, because it often feels like a lingering cold that just won't go away. The truth is, in most cases, Losartan doesn't directly cause a cough, it simply makes your airways a little more sensitive for a short while as your body adjusts. If you do notice a cough that appears soon after starting the medicine and doesn't go away with time, talk to your doctor. It may not be dangerous, but your doctor might want to make sure it's not caused by another medication or an allergy. Drinking more water and keeping the air in your home slightly humid can also help soothe your throat. Some people find gentle herbal teas or a teaspoon of honey before bed offers comfort. If you experience shortness of breath, wheezing, or swelling in your face or throat, get medical help right away. Those are rare but serious reactions. For most people, though, these mild symptoms fade in a few weeks, and the body adjusts beautifully to the medicine. Point 8. Anemia and pale tiredness. Another side effect that can appear slowly over time is anemia, when your red blood cells or hemoglobin levels drop below normal. This doesn't happen to everyone, but it's worth understanding because the signs can be easy to miss. You might notice that you feel unusually tired even after a full night's sleep, your skin looks a bit paler, or you get short of breath when walking up the stairs. Some people also feel colder than usual or experience lightheadedness. Losartan can slightly lower red blood cell production because it affects a hormone that helps your body make new blood cells. For most people, this change is very small and doesn't cause serious problems. Still, if you already have kidney issues or other health conditions, your doctor will likely check your blood count once in a while. These tests are simple but very important. They catch small problems before they turn into big ones. You can help your body by eating foods rich in iron and vitamins like spinach, lentils, fish, eggs, and whole grains. Staying active also improves circulation and energy. If you notice unusual tiredness, pale lips, or shortness of breath, don't just assume it's age, tell your doctor. A simple blood test can bring peace of mind and help keep your strength where it should be. Point 9. Liver health and early warning signs. This last one is rare, but it's important to know. In a very small number of people, Losartan can affect the liver. Your liver works quietly every day, cleaning your blood and processing your medicines, so when it's under stress, you might not notice it right away. The early signs can be subtle, feeling more tired than usual, losing your appetite, or feeling a dull ache in the upper right side of your belly. As the problem grows, your skin or the whites of your eyes may start to look yellow, your urine may turn dark like tea, and your stools may look pale. These are clear signs that your liver needs attention. The good news is, this side effect is very uncommon and usually reversible once the medicine is stopped. Doctors have seen complete recoveries when patients report these symptoms early. You can protect yourself by having your liver checked with a simple blood test once in a while, especially during the first few months of starting Losartan. If you ever notice these warning signs, don't wait, contact your doctor right away. It's always better to be safe than sorry. For most people, Losartan works safely for years, but knowing these rare signals helps you stay one step ahead and in control of your health. Now that you understand the key side effects of Losartan, remember this: knowledge is your best protection. These medicines are meant to help your heart and kidneys stay healthy, not to make your life harder. The goal isn't to scare you, but to help you feel confident about what's happening inside your body. Most people take Losartan for years with no serious problems. The few side effects that do appear can usually be managed easily when you know what to look for and when to speak up. Think of your doctor's visits and blood tests not as chores, but as small check-ins that keep you safe. Write down your blood pressure readings, notice how you feel each day, and don't hesitate to bring up even small changes. You deserve clear answers. Stay hydrated, move your body, eat balanced meals, and rest well. These habits make your medicine work even better. If you found something helpful in what we discussed today, type "helpful" in the comments below. Your feedback matters, and someone else reading your comment might find the courage to take charge of their health too. Remember, staying informed isn't just smart, it's an act of self-care. Take care of your heart, your body, and yourself.